Severe fever with thrombocytopenia syndrome, SFTS, was first discovered in rural areas of China in 2009. It is caused by the SFTS virus, a member of the Binaviridae family. The disease is characterized by high fever, thrombocytopenia, low platelet count, and leukocytopenia, low white blood cell count. It was subsequently identified in other East Asian countries, including South Korea and Japan. The primary mode of transmission is believed to be through tick bites. Severe fever with thrombocytopenia syndrome, SFTS, is primarily transmitted through tick bites, specifically from the Haemaphysalis longicornis tick. This tick species is commonly found in East Asian countries like China, South Korea, and Japan, where SFTS cases have been reported. In addition to tick bites, person-to-person transmission can occur, but it is less common. Such transmission typically happens through direct contact with the blood or bodily fluids of an infected person, which can include situations like caring for or living with someone who has SFTS. There's also evidence suggesting that SFTS virus may be present in domestic animals, like goats, cattle, and dogs, but the role of these animals in transmitting the virus to humans is not yet fully understood. Caution is advised when handling animals in areas where the SFTS virus is prevalent. Severe fever with thrombocytopenia syndrome, SFTS, typically presents with symptoms that usually develop within 6 to 14 days after being bitten by an infected tick. One of the earliest signs of the disease is high fever. Patients often experience gastrointestinal symptoms, including nausea, vomiting, diarrhea, and abdominal pain. A key feature of SFTS is thrombocytopenia, which is a reduced platelet count in the blood, leading to an increased risk of bleeding. This is accompanied by leukopenia, a reduction in white blood cell count, which weakens the body's immune response. As the condition progresses, it can lead to multi-organ dysfunction, affecting liver and kidney function and causing severe neurological manifestations in more serious cases. General malaise is common, characterized by fatigue, muscle aches, and headaches. In severe cases, hemorrhagic signs such as hematemesis, vomiting blood, or melena, black, tarry stools due to gastrointestinal bleeding, can occur. The severity of SFTS can vary significantly from one individual to another, with some cases being relatively mild and others progressing to life-threatening complications. Early detection and supportive care are crucial for the effective management of SFTS. Individuals exhibiting these symptoms, particularly if there is a history of potential tick exposure, should seek medical attention promptly. The treatment of severe fever with thrombocytopenia syndrome, SFTS, is primarily supportive and tailored to the symptoms and clinical conditions of the patient. Supportive care, the cornerstone of SFTS management, involves managing fever, pain, and maintaining fluid and electrolyte balance. This approach aims to relieve symptoms and support the body's vital functions. Close monitoring is essential for detecting and managing complications such as bleeding, organ failure, or severe infections. This often necessitates hospitalization, particularly in severe cases. For cases of severe thrombocytopenia or bleeding, transfusions of platelets or fresh frozen plasma may be necessary. While some antiviral drugs like ribavirin have been used experimentally, their efficacy against SFTS is not definitively established. Due to the compromised immune system in SFTS patients, they are at a higher risk of secondary infections, and prophylactic antibiotics may be used in certain situations. Severe cases may require admission to an intensive care unit for more advanced support, such as mechanical ventilation for respiratory failure or dialysis for kidney failure. It's also important to follow standard infection control practices in healthcare settings to prevent the spread of the virus, especially since person-to-person transmission can occur through contact with blood or bodily fluids. Early diagnosis and prompt supportive care are crucial in improving the prognosis of patients with SFTS. Research into more specific treatments and vaccines is ongoing, which may change the treatment landscape in the future. If SFTS is suspected, immediate medical care is essential.